Welcome to the heart dissection video. In this video, I'm going to show you guys how I open the heart up, and then we're going to trace the flow of blood through the heart, pointing out some different structures and stuff that we see along the way. Here you see a picture of the anterior heart. I want to point out these vessels on the outside, which are the coronary arteries that feed the actual muscle of the heart. Here I'm just showing off the outside of the heart, how there's fat and stuff around the heart, which is the white stuff you see around the actual heart muscle. And if you follow my steps, you should be able to open the heart like I show here. To open up your heart, you should use a scalpel. Make an incision towards the top end of the heart down towards the apex, and do this for both sides, making sure you cut all the way through the heart. This is a gradual process, so start with a fairly shallow cut and then make it deeper as you sort of trace back over it. Here I show off that I made some cuts in the heart so that I can open up the ventricle and atrium so you can see inside. I also show a still image of my cuts so you can kind of see how I did that. Now that I've shown how I made the cuts to open up my heart, now we're going to follow the path of blood through the heart so we can go through some of the structures and things that you guys should know. In an ideal situation, I would show you guys by running a string through the flow of blood through the heart, so I'd be running a string through all the structures involved, but I couldn't actually get a string or anything to really pass through very easily, so instead I'm just going to show you some images and stuff and point a few things out. Okay, so blood enters the heart through a number of different veins like brachiocephalic veins and superior vena cava, and they're going to feed into the atrium. Here's a picture I have of some of those blood vessels where they sort of meet the heart, and I also have L and R labels to denote what the left and right sides of the heart are. So here I have a picture showing some of the structures on the right side of the heart. This red circle is showing where the right atrium kind of is. It's kind of hidden, so I have it opened up. The right arrow shows the tricuspid valve, which is sort of a flap that covers and that sort of separates the atrium from the ventricle on the right side. So that flap is being pointed to by the red arrow, and blood would flow, sit in the atrium, eventually go through the valve into the right ventricle, which is sort of more towards my thumb, kind of where the blue arrow is, but the blue arrow isn't specifically pointing at the ventricles. It's actually pointing, trying to point out the papillary muscle, which can contract to help keep the valve in place. Blood is moved from the right ventricle via heart contractions up towards the pulmonary arteries, which basically direct the blood towards the lungs, where the blood can then be oxygenated and eventually returned back to the heart. So here what I have circled in the red circle is the pulmonary artery, or at least one of them, that goes towards the lungs. Oxygenated blood returns to the heart on the left side, so the blood is going to enter through pulmonary veins into the left atrium. Here you see I have circled a place where blood enters into the left atrium. The blood, once it is in the left atrium, will move through the bicuspid valve, which I have shown by the red arrow, into the left ventricle, which I have shown by the blue arrow. when blood is ejected from the left ventricle, it's going to go up sort of along this path that I've shown with the arrows up towards the aorta. And you can see here I have the hole where the aorta sort of starts opened up with my probe, so you can see where that is. So that's basically it in terms of the video. We've gone over the outside of the heart a little bit and the flow of blood through the heart. I know it's not easy to see the structures on video or on the pictures, but that's just to say I would encourage you guys to come in if you can, because it's easier to see the structures in three-dimensional space and when you have it in front of you. But that's it for today. I'll see you guys next time.